Good news.
Fine needles.
Botox, fillers, vanity, laser removal of hair to defy age.
I'm in 60s when I started it.
Looking 60.
And I love being 69.
A large amount of facial hair.
Mine lasts for almost 2 years.
You can never hide age.
He's the second boyfriend.
Being very conceited and the most important person to myself.
I don't know what it is.
There are safe, comfortable options available.
And cost?
If I had the money, absolutely.
Wanting a good skin at my age.
I do it to please myself.
Aging is tough. So I've got these lines here.
I don't like them.
Aging is tough for men and women, but I think much more so for women. But the good news is there's so much more at your disposal to defy age, at least the outward signs of age. Welcome to Women on Top. On the show today, Dr. Kuldeep Singh, Senior Plastic Surgeon at Indraprastha Apollo, and Nili Singh joins us on the show as well. Dr. Singh, I'll play the role of ignoramus here and say, so what is Botox, and what kind of procedure are we really talking about?
See, Botox is a purified neurotoxin, but the good thing is it is very precise. It can act at one particular point and achieve whatever we want. Botox has been in use for a long time in neurology, so it is safe. It is used in pediatric neurology, most of it, spastic children, migraine. So safety is not an issue.
How does it work?
It is an injection of a precise amount into a precise place which relaxes the muscles at that place.
So I've got these lines here and you can actually inject Botox here.
Yeah, the key is to make the face look softer, more pleasant, fresher. That's all. The key is not to make it different.
Okay. Nili, what prompted you to look at the Botox option?
I realized I was getting a few wrinkles on my forehead, and I wanted to see what options I had. I went to the internet, I went to whatever literature I could lay my hands on. I saw that and I weighed the pros and cons of various procedures and realized that Botox was something that had very few risk factors, while the gain was a lot.
So tell me this, you had your first sort of Botox sitting. When you came out of it and were able to digest the results and the impact that it had, what did you feel like?
I went in and it was about 20-30 minutes procedure, and it was not really very painful, and I got it done and I came out. I felt that there was a result visible immediately.
Okay, so there are a couple of medical points that I just want to understand, and let me just offer myself as a guinea pig here. So let's go back to the lines on my forehead. Take them as an example and say, how long would it take? Would it take 20-30 minutes for me to get a Botox to deal with these lines?
Yeah, getting the injections is quick. It takes a while for the effect to come. In about 4 or 5 days you can see the effect, and in 2 weeks, we say the first time, 2 weeks you can see the whole effect. So it acts slowly and it comes there gradually on the face.
And what about any pain associated with it?
No, these are very fine needles, and most of the patients are very comfortable. They don't even grimace.
At this stage, let me draw in Dr. Savita Date Menon, psychologist with Apollo Wellness. Women, don't really like to talk about some of these options that they've used. I don't know what it is, but in essence the message seems to be, I look this great because I am naturally like this. I'm trying to understand the woman's psychology in the context of external intervention. Can you describe that psychology to us?
I think that if we were all to look at beauty as being natural only, then very few of us would have that gift, because you would have had to have the right genetics for that. So if the rest of us want to look beautiful, I think there's nothing wrong with it at all. However, it is socially acceptable if you have used natural remedies, herbal remedies, and then you talk about it, society accepts it.